More signs the Ebola virus remains a global concern. Spanish authorities are coping with the first case of Ebola transmitted outside Africa. A Madrid nurse who had treated 2 Spanish missionaries with Ebola is being treated for the disease. A Norwegian national has been flown home with Ebola, and health officials in the United States are keeping a close eye on 2 patients with the disease. CCTV's Nathan King joins us with the latest from our newsroom.
Thanks, Mike. While the centre of Ebola outbreak is still in West Africa, there is a growing concern about the spreading disease. Governments around the world are considering new measures to keep their populations safe. Thomas Duncan, the man who contracted Ebola in Liberia before flying to Dallas, Texas, is in critical but stable condition, however showing a slight improvement according to doctors. Family members arrived Tuesday at the Dallas hospital, and Duncan is undergoing treatment with an experimental drug. Meanwhile, in the state of Nebraska, freelance cameraman Ashoka Mokpo, who contracted Ebola in Liberia, is also getting hospital treatment. He was strong enough to walk off the plane that brought him back to the US on Monday. And elsewhere, Norway has also repatriated one of its citizens who was infected with the Ebola virus in Sierra Leone while working for the medical charity Doctors Without Borders. In Spain, the nurse who became the first case diagnosed outside of West Africa was moved to a Madrid hospital. 3 others, including her husband, have been hospitalized, and 22 others are being monitored. Meanwhile, public health workers in Spain have been protesting the government's response to Ebola. The US government is considering ramping up the screening of travelers arriving in the US from West Africa. Airline passengers arriving from Liberia, Sierra Leone, Guinea and elsewhere may get extra screening at major airports.
In the coming days, we will announce further measures that will be taken. Right now, I can give you some basic principles. We want to ensure, and we will always ensure, that the health of Americans is our top priority. We want to ensure that anything we do works and is workable. We recognize that whatever we do, until the disease is controlled in Africa, we can't get the risk to 0 here.
The US government is considering ramping up screening of travelers arriving from West Africa. Airline passengers from Liberia, Sierra Leone and Guinea may get extra screening at major US airports. A flight ban from affected countries has been ruled out because officials say it would hamper the flow of emergency personnel. The international response, meanwhile, is continuing to ramp up. The US is providing money to help build treatment centers as well as troops. China is sending healthcare professionals, and European countries such as Germany are also adding assets. The US says it's doing as much as it can, as quickly as it can.
The speed at which these things are done is it's not just one challenge with doing that. Part of it is the ability of the host nation to absorb it. As you can imagine, their infrastructure and their capacity to house people, to feed people, and all that is limited. So it's all going to have to come in a very, very carefully orchestrated, based on the demand out at the front.
One other nation's efforts worth mentioning is Cuba. They're lending their significant healthcare assets to the effort. 165 healthcare workers are in Sierra Leone from Cuba, and nearly 300 Cuban doctors and nurses are also being trained in the fight against Ebola and will be dispatched to Liberia and Guinea soon. The largest single national contributor so far in terms of healthcare professionals, Mike.
Nathan, while there have been an increased international effort, those numbers of cases in West Africa, they just keep on growing. What's the latest there?
Yeah, let's go through these figures. We have the latest death count, 3,431. That is Liberia, Guinea and Sierra Leone. And the total case count, around 7,770, with only 4,087 of those confirmed in the lab. Now, a lot of these cases may actually be bigger because of the fact that these cases are in rural areas largely. The true numbers could be a lot higher. We've seen all the predictions, haven't we, Mike? If this outbreak is not stopped and stopped soon, then we could see tens of thousands, if not hundreds of thousands of cases going forward. One silver lining is Nigeria, the most populous country in West Africa, seems to have stopped the Ebola virus in its tracks. No new cases have been reported there for weeks, a spur, if you like, to the international effort in the rest of West Africa that this virus, despite its lethality, remember over 60% die who get this, can be contained, Mike.
Nathan King, live from our newsroom. Thank you.
Thank you.